Good morning, good afternoon, good evening, all. Today, 13th August 2022, I welcome all of you for this platform, Ifph platform. This is the 712th day of uninterrupted daily webinar of Ifph, International Forum for Promoting Homeopathy. Today, our guest is Dr. Jayaleksmi, MD, Homeopathy. Let us have a 1-minute silent prayer to get blessings from God to deliver her speech in a very nice way. So let us pray for 1 minute silently pray. Thank you. Thank you all. I told you that today our guest is Dr. Jayaleksmi, MD, Homeopathy, Honor and Chief Consultant at Sri Shah Homeopathic Health Center, Vijayanagar, Bangalore. Served as a senior consultant Kagalli Halli to serve learning disability children and worked in Women Project in a rural place, treated many cases of gynecological disorders. Successfully have treated more than 2 lakhs patients. That is great. Served as a senior consultant in charitable services, MLD-MIH from 2005 to 2021. That means 16 years in a charitable institution. She had worked as guest lecturer in many reputed institutions, presented at national and international forums, including on at Dubai, winner of many awards, and above all, 27 years of clinical experience. Today, our subject is scope of homeopathy in pathological chronic diseases. Thank you, doctor. Now the next 45 minutes for you to deliver your speech, and after that, there will be a discussion on that subject. Thank you, doctor. The floor is yours.
Yeah, thank you so much, doctor. I'm very humbled by your the way you introduced me. Thank you so much. I am presenting one of the case, which is like patient came in a very bad state, and instead of presenting many cases, one case will take in depth, in details, okay, and how patient came and what happened, the process, and what we achieved in the case. Okay, that's what my intention of this presentation, and also look at how homeopathy can really relieve. So I'll start sharing my screen. This is like patient name is SGB. Date of consultation is 11th June 2019. Age of the patient, am I audible?
Yeah, you're audible.
Okay, thank you.
No problem.
The age of the patient is 17 years, male. Education was, he was studying, like he had completed 12th standard and he was pursuing his BBM. He comes from a religion, Hindu Madhva. Father, 47 years, works in a private firm. Mother, 42 years old, homemaker. The resident, he stays in Bangalore. What was the complaint he came for? There was frequent episode of severe pain, abdominal pain, sudden onset of pain, which was gripping and relaxing. And pain was piercing, and it was moderate to severe, and it was a continuous pain. And how the patient was like, the allopathy doctors had given up, like they had fixed what was going to happen next 1 month to 3 months. That's what is going to be alive. And I will show you the reports, what was there. And the modalities were aggravation if bladder is full and not passed urine, and pain aggravation if not passed stool, any movement, eating chapati, and if anger is not expressed. When he was better was if there was no movement, he being still. What were the concomitants? He was very irritable during the pain. He cannot talk. He scolds, shouts if someone talks to him, irritable. Patient is like lean built, 38 kgs. He had lost almost 15 kgs of weight after he developed this problem. Perspiration, whole body from increased exertion. Appetite was normal. These are the cravings he had. Aversion to sweets. Elimination, severe pain while passing stool. Severe abdominal pain. Consistency was normal. His thermal was C2H3. So what he came for? Like, let me go to the reports. Then we will go to the life space investigation. If we go to the evolution of his complaints, how all this started was, he had acute abdominal pain in 2015, September, with bilious vomiting. He was diagnosed acute appendicitis clinically. And his CT abdomen showed, no, there is chronic appendicitis and there is granulomatous lymphadenitis. Because of this granulomatous lymphadenitis, they suspected tuberculosis and they gave ATT, anti-tuberculosis treatment for 6 months. So he was on treatment for 6 months for this. There was weight loss. He was weighing 33 kgs. And he was operated as well during the same period for appendicitis. But still after the operation, the continued intermittent abdominal pain was there. In 2016, and see, 2016-17, all his reports showed that he has ileal ulcers with strictures and they were suspecting Crohn's. So what happened to the tuberculosis diagnosis? We really do not know. It was suspected and he was treated for that. Now they are coming to Crohn's disease suspect. No, they are suspecting because there are strictures in the intestine. This is the findings in 2017 MRI. So it showed small bowel strictures post ATT. In 2017, because of the time, I'm just going through this, the impression of the reports, not the details of the reports. What is the impression is moderate chronic active ileitis with evidence of crypt distortion. And there is no granuloma or mucosal ulceration present. Lesional chronitile crypt distortion, overall features could be consistent with chronic ileitis. That's what in 2017 it's showing. In 2017, again, like the pain continued. Why so many MRIs done? Because his pain not better in spite of ATT treatment, in spite of appendicitis operation. Now Crohn's disease is clear now in 2017. And he has been treated ongoingly with steroids and with all the allopathic tablets. See, in microscopy, we show small intestinal mucosa with preserved crypt villus architecture displaying edema. So there is edema there in the intestinal mucosa. There is focal mild to dense infiltrates of lymphocytes, plasma cells and good number of eosinophils in the lamina propria. Cryptitis is mild. Gastric mucosa is preserved. So there is lymphoid aggregates. There is collection of epithelioidal histiocytes forming epithelioid granuloma. There is focal enteritis, granulomatous gastritis, or all in favor of chronic Crohn's disease. So in 2017, no, what we see here in September report, there is splenomegaly, hepatosplenomegaly, there is multiple segmental ileal thickening, stricture with intervening ileal dilatation. So we see progression of Crohn's disease here. There is a comb sign, hypervascular mesentery noted giving rise to comb sign. There is mild free fluid noted in the pelvis. Says there is segmental dilatation, which was not there in earlier reports. We see dilatation of ileal loops. Delayed transit of contrast noted into the colon. Thickening of cecum we see now. So impression is like there is hepatosplenomegaly, there is multiple segmental ileal thickening, stricture with intervening ileal dilatation, multiple enlarged mesenteric lymph nodes and hypervascular mesentery, mild free fluid in pelvis. So 2018 CT continued. Now we see mild ascites is noted. So continued progression of the disease. Now ascites like portal system we see the excavation extravasation of fluid and ascites setting in here. So we see multifocal areas of short segment circumferential mural thickening. I'll not go into the complete details of the report. So again, there is progression of the Crohn's disease. So what is the present study shows multifocal skip areas of short segment, circumferential mural thickening in the mild and distal ileal loops causing luminal narrowing as setting now. Because the pathology is progressed. The edema, the inflammation, the thickening of the mural wall is giving to luminal narrowing. There is enlarged discrete mesenteric lymph nodes. There is hepatosplenomegaly. So 2019. So throughout this, there is steroid continued, allopathy medications have been continued, but progression is not stopped. His pain continued and progression continued. So now we see in 2019 portal vein is dilated. Minimum free fluid is noted in pelvis. Mural thickening is continued. Luminal narrowing is continued. So submucosal fat deposition. There is hepatosplenomegaly. So everything is continued and progressing. So this is his report, 2020 report. So there is proximal ileal multisegmental mural thickening with mesenteric fat proliferation, prominent vasa recta, and mesenteric lymphadenopathy suggestive of inflammatory bowel disease, Crohn's disease. Mild hepatosplenomegaly with tiny granulomatous calcification at segment 7 and 8. So as a homeopath, we need to look into his life space also. Why he developed this at this age? What is the cause? So when physician went on looking at it, his life space showed father always angry look. Father would hit him for any wrongdoings and mistakes. So child had fear of father always. Experience of suffocated in his father's presence since the age of 4 or 5 years. In childhood, patient missed abacus class, went to one of the incident he shared. He went to aunt's house. After knowing this, his father would hit him for 20 minutes, violently using both his hand and foot. Mother should be there with him when father was there from young age. So can you imagine what this child, not uttered single word in spite of father beating him for 20 minutes. What is a child experience? So mother should be there with him when father was there from young age. Mother scolding or repeating same. Stop talking till mother asks sorry. About mother, always told mother, don't show others anger on me or I will escape. and he defends himself by holding his mother's hands and give tickles to his mom, was never free with father. Important even in patient life when he was in 5th standard. Patient's expression did not feel anything. That's what I know, like beating from father for 20 minutes. That's what this sentence regarding that event says. Never expressed anger so far with father. When patient is in the presence of his mother, gets angry, pushes objects or throws things, goes and sits in aunt's house and complains to his mom, that always his father scolds him. Patient would cry, never expressed, never during beating also. What is mother nature? Mother scolding or repeating same, stop talking till mother asks sorry. About mother, always told mother, don't show others' anger on me or I will escape. He defends himself by holding his mother's hand or gives tickles to his mom. Patient would silent but not scared. Family history is maternal grandmother, diabetes mellitus, died at 83 from myocardial infarction. Maternal grandfather had intestinal cancer, died at 70 years. Paternal grandfather had diabetes mellitus for 10 years, died at 70 years from myocardial infarction in 2009. Why this shows the fundamental miasm? Is he genetically prone to this disorder? That's why this history becomes important. So let's look at Crohn's disease. Crohn's, it's a chronic inflammatory bowel disease. It's protracted, relapsing and remittent course over years. Any part of GI tract from mouth to anus can get affected. Most common is in young adults. Factors associated with the development of inflammatory bowel disease. 10% have first degree relative or at least one close relative with inflammatory bowel disease. High concordance between identical twin. It is associated with immune thyroids or SLE, systematic lupus erythematosus. Linkage with mutations in CARD15, NOD2 gene on chromosome 16. Other regions of linkage of chromosomes 12, 6, 14. HLA-DR103 associated with severe ulcerative colitis. Ulcerative colitis and Crohn patients with HLA-B27 commonly develop ankylosing spondylitis. Crohn's, most patients are smokers, but this child had no such history. Associated with low residue, high refined sugar diet. Pathogenesis. Inflammatory bowel disease develops as a response to triggering genetically susceptible individual. Cellular events, activation of macrophages, lymphocytes, polymorph nuclear cells with release of inflammatory mediators. Intestinal wall is infiltrated with acute and chronic inflammatory cells. What is the structure involved? It is inflammation is transmural, fissuring ulceration with inflammation extending to submucosa. So one thing as a homeopath, we need to be very careful. Why so many MRIs done to look at any, if the fissuring happens, the intestine gets, this kind of fissures, fistula, then it is fatal. So we need to be very careful on this while treating. So that's why your MRI, CT scan really helps in this disorder to assess where are we regarding while treating the case. So what is a common pattern? Pathogenesis. See, we need to know we are treating Crohn's disease. It's also close to both are ulcerative colitis, both are inflammatory bowel disorders. So in ulcerative colitis, we see there is proctitis or proctosigmoiditis, 40 to 50% involvement of this portion of intestine. And it is mostly left-sided or extensive colitis we see, 30 to 40%. And pancolitis, like complete involvement of this large intestine we see 20%. In Crohn's disease, it is ileal or ileocolonic 40%. Small intestine, it is 30 to 40%. Crohn's colitis, it is 20% affection we see. Perianal disease alone is less than 10%. So can we see here in histopathy, in this picture, the penetrating, fissuring ulceration. So when the repertorization done, these are the symptoms were taken. Kent's repertorization, Kent's totality, the Kent's order of totality was done. Okay. And we see, the first symptom was taken, ailment from suppressed anger, contradiction least from. So he mother shared, like he cannot take any contradiction. Many mobiles have been broken, like when he's contradicted, but never showed his anger with father. Anger violent, anger throw things around, anger better by eating, weeping pain during, nausea and vomiting during pain, pain abdomen if urination is delayed, pain abdomen better rubbing, pain squeezing, pain abdomen aggravation standing, better passing stool, passing gas. Sorry, this is it is not cough. It's not cough. It's wrongly typed. Crave fried things, craving salt, craving sweets. Okay, this is the totality, repertorization. We see among, like, Stefisa Gray has covered 12 symptoms, 4 symptoms, 12 symptoms. Zinc has covered 10, natramure has covered 8, natrum corp 7, mac corp 5. Like these are the marks, is been secured. So if we go to the, like Stefisa Gray covers like ailments after anger, vexation, 3 marks. And anger contradiction from it covers, anger violent it covers, throw things away covers. So let us look into whether it covers the other aspects of the case. So mind is covered in most of the mind symptoms are covered by Stefisa Gray. So closely coming remedies are also zinc, natramure, natrum corp. Stefisa Gray, was given in the case. Impressions made upon the mind, then upon the body guide to Stefisa Gray as a remedy. Easily aroused to anger, excitable, but seldom irascible. See, in Kent's Matra Medica, if you open the Stefisa Gray chapter, clearly says, mental symptoms are very important and the impression made upon the mind and then upon the body guide to Stefisa Gray as a remedy. Excitable, easily aroused to anger, but seldom irascible. Easily disturbed, excited, but seldom manifest it. Suitable in cases where complaints come from pent-up wrath, suppressed anger, suppressed feelings. The person becomes speechless from suppressed indignation, anger with indignation, complaints brought on by these causes. And which are the closely coming remedies also colocynth. Okay. And we see Stefisa Gray is like, it affects the mind, it directly goes to the intestine, Kent says. And also colocynth covers. Colocynth, Stefisa Gray, causticum are all closely related remedy. Because of this highly standing, from repertorization from Kent's Matra Medica, Stefisa Gray is the indicated remedy and it was given. Colocynth was also given whenever there were acute pains. Colocynth, anger with indignation, easily offended, anger followed by violent neuralgias in the head, eyes, down the spine, in the intestine, great weakness and pain, severe colic, severe tearing neuralgia, so severe, unable to keep still, better pressure, better rest, better heat. All pains are better from pressure, but this is in the beginning. After the pain has been going on for several days with increasing severities, the part becomes sensitive and pressure cannot be endured. So when pain becomes intense nausea and vomiting we see, until the content of the stomach are ejected, continuous retching and vomiting until the severity of the suffering decreases. That's what we see in colocynth. So let us see, I think I don't know how many of you understands Kannada. The interview has been done. This is the boy. Okay.
It is not audible, madam. After that, you can say that what they are saying. Okay.
Okay. Okay. So this person is like interview at the end, because I did not take any of the how he was in pain, any photographs or videos in the beginning, because my focus was to treat him, relieve him. He came in like a very bad state, and surgeons had given him like he's not going to be alive, as it is autoimmune disorder. He's going to be alive only for next 1 to 3 months. That's what they had told. But he's completely better, and almost they don't come at all for treatment now. They come once in a year, 1.5 years. No, they 2 days back I called him to see, because I'm presenting this case. I wanted to be bringing authenticity in the presentation to look at how he is. There is absolutely no pain. Okay. And it is almost 2019 they came, and I don't see any complaints now. It's absolutely fine. So if you look at the aphorism, what Hahnemann stated, the physician clearly perceives what is to be cured in disease. That is to say, before that I wanted to say, he was started with Stepsacria 201 dose, then went to 1 m, then he needed up to 10 m. Initially from infrequent doses to later frequent doses. And now almost it is 1.5 to 2 years, no medicines, 1.5 years, no medicines. Is on no medication, is perfectly fine. So if we look at the aphorism, if the physician clearly pursues what is to be cured in disease, that is to say, in every individual case of disease, knowledge of disease indication, if he clearly pursues what is curative in medicine, that is to say, in each individual medicine, knowledge of medicinal powers, and if he knows how to adopt, according to clearly defined principles, what is curative in medicines to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensure to adopt it. As well, in respect to the suitability of the medicine, most appropriate according to its mode of action to the case before him. Choice of the remedy, the medicine indicated. As also in respect to the exact mode of preparation and quantity of it required. That is posology. Okay, how many doses we give, like proper dose and a proper period of repeating the dose. If finally he knows the obstacle to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judiciously and rationally and is a true practitioner of the healing art. Now, as in the cure affected by the removal of the whole of the perceptible signs and symptoms of the disease, the internal alteration of the vital force to which the disease is due, consequently the whole of the disease, is at the same time removed. It follows that the physician has only to remove the whole of the symptoms in order, at the same to abrogate and annihilate the internal change. That is to say, the morbid derangement of the vital force, consequently the totality of the disease itself. But when the disease is annihilated, the health is restored. And this is the highest, the sole aim of the physician who knows the true object of his mission, which consists not in learned, sounding, prating, not in giving aid to the sick. So, it's completely better. Almost I treated him for nearly 1 year in my clinic. And then for few weeks to months, we gave maintaining dose, Stepsacria. hardly needed any intercurrents. Whenever there was severe pain, I have also tried colocynth, but what mostly immediate relief was stepisagria. Okay, when I went back and read in Kent's repertory all the books, like it has gone deeper and it has made a shift, the cause and effect. When we see, in the case, and that's where the healing has occurred. Now, if we see, he's more cheerful, his anger is like hardly he gets anger, and he's so, he's the way he's relating to his father also is very friendly, which was not there earlier. And with mother also, the way he is more affectionate. And mother also, I have done few conversations and sittings with mother also. So there is a lot of shift in mother, how she is with him. And also with father also, I had 1 or 2 sittings, and then the way, everything in total, how the homeopathic physician come as a family physician, how, friend, philosopher and guide. So totally the family is now happy, and the healing, true healing has taken place for the person. That's what I wanted to say. If you want to see this video, in this video, mother was very happy in sharing how the child was and how he has become now. And this boy was not like this. Like he gained almost after treatment 15 kgs of weight. Now he's 53 kgs. He's perfectly fine eating all the foods. Earlier he was not able to take any food. And there was one of the MRI report, there was adhesions, there was luminal narrowing, all that was there. One of the report, I think, I should show you. I have another 7 minutes. I'll show you, if it is there here. We see in the report, is like much better. All the pathological changes, is, in 2021, I have one report. So that report there is a lot of changes which are showed. 2020, this is. So latest report 2021, I got it done. MRI report, it shows the the pathological changes which was there, just all all minimized. Almost it was better. He's eating all kinds of food now. Like he completed his almost he has another 8 days to go for his completing his degree, and he got posted in he got appointment in Wipro. Now he was happy to share. He brought the sweets and gave. He's looking at pursuing his post-graduation also now. And they are very thankful. No, we should thank homeopathy for causing this miraculous cure. I'm done with this, doctor. Anything else?
Hello.
Hello.
Okay, doctor. It was a nice presentation and very nice to hear. There are so many people want to ask you some.
Yeah. Any questions you have, any doubts you have, anything I need to answer, please freely ask. My best possible way, I'll share my thoughts on that.
Kurup sir.
Audible.
Yes.
Yes, doctor, it is audible. You can ask.
Dr. Jayaleksmi.
Yeah.
What you know that Jaya means winning. So you are a winner itself. It is a very good excellent session. Even pathological cases, we are able to what allopathy cannot or the other systems cannot cure, that we are able to cure, that you are shown. Of course, it may take some time. It is the reverse changes must happen. It will take time. In different stages, it may go back. So it may take time. It is quite natural. Thank you very much. Come next time also. I like to ask one question. Polosynth, what was the potency? Which potency you gave? How many often you gave? Polosynth?
I started with 200. Initially 3 doses per week. Then he needed daily doses.
Okay.
That was susceptibility. Assessment of susceptibility was moderate to high because of the mind which was involved. And there were characteristics which are available. Considering the pathology which was there, I couldn't, it was not guiding to go for 1M or 10M. 30 may be low because of the mind involvement. So started with 200. Initially was partially better. Then he needed, it showed that he needed high, went up to 1M. And at the end, he needed 10M for the pains, whenever was there pain.
That you told about the Staphysacia, that I am asking about the Polosynth.
Polosynth. Polosynth was given was 200. 200 4th hourly.
4 hourly. Okay. SOS, whenever required. That is
whenever was required, yeah.
Okay, thank you. Keep it up. Come again with some other such wonderful cases.
Thank you.
Congratulate you with high respect. Thank you. Keep it
Thank
up.
you. Thank you so much.
You know that Crohn's disease is a very serious one, but I want to ask you something. Doctor, there is mesenteric lymph adenitis is there. Did you consider it seriously?
Yeah, mesenteric lymphadenitis, because of that, they suspected tuberculosis and they started tuberculosis treatment and ITT treatment.
Okay. Do you done anything for it?
Yeah, in the latest report, we see there is no lymphadenitis.
Okay.
That's why the lymphadenitis has gone. Even 2020 report, there is no lymphadenitis. 19, we started the report. We started the treatment.
That time it was there, isn't it?
It was there. It was there till we started the treatment. In 2020 itself, it has gone.
Okay. Doctor, now Dr. Hariharan, sir, you can unmute yourself. Sir, unmute yourself. Unmute.
Please unmute yourself.
It is muted, sir. No. It is not. Yeah. Now,
yeah.
okay.
Unmuted. Yeah. Doctor, you have done a wonderful work. You have a deep knowledge regarding Crohn's disease, that is the inflammatory bowel disease.
Yeah.
And you have given Staphysacia, that is Staphysacia and Polosynth. It is a psychosomatic disease.
Yeah.
So you gave Staphysacia.
Yeah.
Then occasionally you gave Polosynth. That is in order to relieve the pain of the patient.
Yes.
First, finally, that Dr. Hubert said that lymphadenitis about the lymphadenitis, but allopaths suspects it is tubercular lymphadenitis, and they give, I think, streptomycin or something else. It may
anti-tuberculosis, yeah.
And they may did so harm to the patient.
Yeah.
So, but actual treatment you done and the patient is get cured. See, the final report, it is shown that lymphadenitis have disappeared.
Yeah.
It may due to the inflammatory condition of the bowels, that lymphadenitis appeared. When the inflammatory condition disappeared, the lymphadenitis also disappeared. Yeah, okay. Then final report, it is neural thickening, it has shown. Neural thickness shown in the final report. that maybe, I think, it is a scar tissue. I suspect that it may a scar tissue formed at the intestine. This scar tissue may come a pathological dilemma in future. I think it's so. So you have to give 2 jars. That is my conclusion.
Got you.
Okay.
Yeah.
Very nice, doctor.
Got
Very
it.
nice.
Got it. Thank you, doctor. One thing I want to clarify, because there is audience here, there are experienced doctors are there, might be there are beginners. We need an indication to give intercurrent. There is mural thickening. Definitely, there will be some post recovery fibrosis might have set in, or some thickening might have left. But the report shows like lot of recovery from the what was there pathology, and patient is much better. There are any again repeating of symptoms, then we need to think of whether we need intercurrent.
Sometimes, madam, sometimes it may become too late.
Okay.
If the patient complains after 2 or 3 years, the patient will come to you that I am having pain in the abdomen. And when you stand it, it will show some polyp, some thickening, and it may have shown some growth at there. So we will think. So I missed.
Yeah.
So
Thank you. Thank you for the input, doctor. Got you. Got your point.
okay, thank you, thank you.
Thank you so much.
Okay, you are wonderful, doctor. You come with another case.
Yes, I am so much. No, I want to be associated with this group. I am so humbled. I like to present more and more cases. I have very rich cases experience.
Doctor,
I think this platform I'll bring all the cases.
This is the systematic method of homeopathic prescription.
Yeah.
Systematic method of homeopathic prescription. So we must know how to stop the medicine. Okay. Thank you very much.
Thank you, doctor. Thank you so much.
Okay, Simon, continue.
I think not heard, doctor.
Some others are raised to their hands.
Nobody has raised, I think it's so.
I think
one more.
Ahmad Hassan sir wants to say something. Can you unmute yourself, sir, to speak?
Okay. To whom you are?
Ahmad Hassan sir has raised
Ahmad
his
Hassan, sir. Ahmad Hassan.
digital hand.
Dr. Hubert, you unmute Ahmad Hassan, sir.
Dr. Hubert, sir. Dr. Hubert, sir.
Not hearing, I think so.
Or Ifph technical can do that.
Okay.
Request them. Dr. Hubert, please, Ahmad Hassan,
Yes, sir.
and one more is there. Our regular.
Good evening to all. Thank you, madam. Very nice presentation. I am a medical technologist, so I work in histology. I see so many reports about this Crohn and IBS, but I never asked our physicians, consultants, sir, what you are giving. So thank you very much. I came to know about this recovery from the homeo remedies. And if you can share your number, thank you very much.
Yes.
May I Almighty bless you.
Thank you. Thank you so much. I will share my number.
Muhammad Saidan, sir, can you hear? Oh, he's our vice president is Dr. Shaji Kudir is there. Sir, you can unmute, sir. Shaji Kudir, sir.
Yeah, yeah. Sorry, thank you. I
Good
just
evening, sir. I heard
came
your
in.
name
Good
many times. Today I got
Okay, thank
got
you,
to see
thank
you,
you,
sir.
thank you. It was
Thank
a
you,
good
Dr. Shajis.
presentation. Yeah, I wish to ask you which medicine you give for the child as a constitutional medicine.
Pardon, sir?
See, I was not able to completely hear you. I was traveling and driving while hearing
Okay.
you. So, which medicine given to the baby, to the child with as a constitutional medicine?
Constitution was Staphysagrina, doctor. He was 17 years old boy when he came to me. His constitution was Staphysagrina.
Okay. Just that's all. You are such kind of cases we need to present in our forum, because this forum is mainly to promote the homeopathy as an evidence-based medicine, to boost the morale of homeopathy doctors and ordinary people, so that the effectiveness and healing potentials of homeopathy will be spread around the world, to the nook and corner of the world, so that people at large will be able to utilize this wonderful system for the health benefits. So that's why we formed this organization at the time of pandemic, when none of the organizations were able to raise the voice for homeopathy regarding the effectiveness of homeopathy for against viral infections, including COVID-19. So we came forward, we started these Zoom meetings. Today, we continuously done it more than 700 days, and we are going forward. So people like you and everybody who love and believe in homeopathy and experience the effectiveness of homeopathy should join hands with us and make it as a dominant spreading homeopathy spreading venue, so that so many will be benefited. So thank you for joining us, and keep continuously joining us, so that your experiences will be beneficial to others. Thank you.
Yes, thank you so much, sir.
Thank you,
You are
Dr.
from
Shadi.
Bangalore? You are from Bangalore, doctor?
Yes, I am from Bangalore. I stay in Vijay. Clinic is also in
Where
Vijayanagar.
in Bangalore? Where?
Vijayanagar.
Where? Vijayanagar. Okay.
Vijayanagar.
Okay. Yeah.
Thank you, Dr.
Thank you.
I think Sir Mohammed Jaidan wants to, he has raised his digital hand. Sir, do you have any questions?
Yes, ma'am, audible?
Yeah, you are audible, sir.
Thank you. That was interesting lecture. I have a comment and a question, but it is an odd question to somehow. The TB treatment is aggravating the situation by killing the microflora of the intestine. This leads to leaky gut, and leaky gut leads to leaky blood-brain barrier. That will affect on the brain mental status. This will aggravate the situation and make the treatment more difficult. This is the comment. The question is, what is the specific effect of Staphysagrina on the stomach? Is there an evidence that the Staphysagrina, what did Staphysagrina change in a stomach? Because such diseases are originated in the stomach, but we take it as a whole. When we treat, we take it as a whole. Origination, somatic-wise, is in the stomach. Do have Staphysagrina an effect on stomach? Do you have an idea?
Yes. What is Staphysagrina has done? No, we know from the Kent's Metamedica, all the source books, that Staphysagrina mind how it affects the intestine. Now, if we look at the reports post-treatment, we see the edema has come down in the intestine. We see the ascites has come down in the intestine. We see luminal thickening has come down. It is like really minimized. So, and we see, yeah, it is also.
Sorry, is it related to stomach pH?
Yeah, it is acted. It has acted on the intestine. It's a complete alimentary canal. What is it? it affects Crohn's disease. And also Staphylococcus affects the anger directly goes into the intestine. It affects the intestine. And we see no inflammation has come down. So inflammatory activity has come down after we gave Staphylococcus. So what is the retrospective study here is how homeopathy medicine indicated similimum, the perfect similimum, how it can impact the reversing the pathology. And I am not given last 1.5 years is not on any medicine. 2 days back, I called him because I am presenting here. I called him. I want to see you come. Both mother and son came. And
Thank you very much.
Thank you, doctor. Thank you, doctor. Now, Dr. Danish is there.
yeah.
Our backbone.
Dr. Danish, thank you so much. No, I troubled you for few corrections. Thank you. Today I got to see you. Yeah.
Good evening, all, and good evening, Dr. Jayaleksmi. It's a wonderful presentation from you once again. Even though you are presenting for the first time in this forum, your presentation was really excellent because she is doing a lot of work to promote homeopathy in all part of this Bangalore, not only alone in Bangalore, but almost all part of the country, Karnataka. She is working in all part, in all different situations for even educating students in learning disabilities, and she is rectifying so many defects in that kind of children. Not only that, she is working as a very good doctor as well as a personal friend to many of the women to uplift their empowerment. And this is what a homeopathy can do. She got many awards from different parts. Particularly, she got very recently an award from the Air Marshal, and for her reputed service during COVID.
Yeah. As you know, from Army Association, I got the award.
Yes, a pandemic which is really big, hitting high and hard over Bangalore. She was working without any remuneration for many serving the people in almost all those areas where it was affected heavily. And this is something that every homeopathy can do. She is working as a role model for every homeopathy who is there in Bangalore. I would like to, your presentation, really, the case also was a very interesting one, even though that is a chronic case. She was able to cure, that is a homeopathic cure is, as you all know, that it is a complete total cure. And that is only possible with homeopathic medicine. Otherwise, in allopathy system, usually they will go for surgery once and one after another, but still the patient is suffering without any permanent cure. I have seen so many cases of that variety, but with the homeopathic medicine, we are able to cure with some of our simple medicine. But the thing is that you need to study homeopathy in such a way in the mind. You have to catch the mind of the patient in a beautiful way. And if you got the right symptoms and you are able to say choose the right rubric, and that definitely you will get the right medicine. Of course, thereafter you have to analyze the case and then find out the similimum, and then you have to think about the potency. What is the intensity of the potency to be selected to that particular person, since it being a chronic case. Sometimes some people believe that it is the 6C or something to begin with, but usually people used to start with the, I know Dr. Nigam is one of the legend from Pune. He used only 30th potency. Whatever be the case, whether it be a chronic or an acute case, he used only the 30th potency. As far as 30th potency is concerned, it also is a big potency, not a simple potency. But your mode of different, and you have chosen the 200th potency in that case to begin with. That's also a beauty, because it all depends upon the doctor to choose the right potency in the right situation. Anyway, and that's a very good presentation indeed, and really we were thrilled to see presentation, because this is a system, this is a platform where we want to promote homeopathy, as just like Dr. Shaji Kudiyat, our Vice President, has told, to promote homeopathy, to reach among the people that we are doing this kind of cases, and we are getting a lot of presentation from all part of the world. And we will have another presentation coming on next week from a doctor from Germany is coming. another doctor from UK is coming, and everybody is presenting here. That is the beauty. We are presenting different kind of cases without any interruption. That also, I hope that you can also come up with some more presentation. I would like to ask one question. Here, the so-called medical bill is about to be finished, published in Kerala, release or the bill is to be published in Kerala by Kerala government in the coming session of assembly. But what is going on in your current district, in your state, Karnataka, in those respect, whether there is any medical bill is about to present or not, and what is the strategy adopted by the government to homeopathy? Here, the conditions are that almost all contagious diseases are not supposed to be treated by homeopathy or Ayurvedic or Ayush doctors. What's your opinion on that, and what kind of situation is going in Karnataka? We would like to know about that, because it's being a different scenario after COVID. As you know, COVID really, the government has prevented most of us from practicing for COVID. What is your opinion on that? What is the situation in Karnataka?
Yeah, I don't know whether to speak it openly here or not. Actually, what we saw in COVID, no, it took a lot of time for them to accept, give permission to practice homeopathy here. Like almost myself, I have distributed more than 1 lakh. We waited. No, Ayush has granted, Ayush department gave green signal for us to give homeopathy medicine. With that basis, immediately Dr. Rudresh is doing a lot of work here in at the government level. Okay. And
Thank
after
you,
they
Doctor.
gave, we started.
Now the time is running out.
Yeah.
So please write your chat box, your number,
Yeah, I'll
contact
give
number.
my phone number, and I will come up with more cases. That's what I want to. Yeah.
You please write in the chat box your contact number. Now, Dr. Manoj, please say a word of thanks.
On behalf of IFPH, I am proposing a vote of thanks for your presentation and request you to come again and again, and also to participate regularly in this program, and should also try to bring others to the platform also.
Yeah.
Once again, thanks for all. Thanks.
Yeah.
Thank you very much,
Thank you.
Doctor.
Thank
Dr.
you so
Manoj.
much for giving me this opportunity to share in this dais, trusting me and giving this opportunity. It's like, again, it made me to revisit the case, the whole case, how the journey went on.
Thank you,
Next
Dr.
week,
Jia.
a different case. Yeah. Thank you.
Thank you very much for your kind cooperation. And now it is the time for us to start our Malayalam session, our local language. Dr. Yahya, are you there? Okay. You can see, please moderate the Malayalam session. I invite Dr. Yahya, our joint secretary, to conduct our moderating our Malayalam session.